And it's now really my honor to introduce Dr. Karen Edison. So we've heard a little bit from her already. And you do have her full and very thorough bio in your handout. So we're really lucky to have her here with us today. She's joining us today in her capacities with the university. So of course, being both a professor and chair of the Department of Dermatology here in the School of Medicine. She's also medical director and has a long history working with Missouri Telehealth and is the director for the Center for Health Policy. Her experience is both clinical and field related, as well as including research and data analysis and policy and advocacy change. We're really pleased to invite her up now to help us think about how we transition this conversation, all this research, the important questions that we talked about related to data, transition that into meaningful action and into an opportunity to get to know one another here in the room, to carry that work forward outside of this meeting that we've made time for today. So with that, I'm going to invite Dr. Edison up.
Thank you, Michelle. So this whole question about how do we take all these data and translate them into something actionable and meaningful. I was at a health policy meeting this weekend in Washington, D.C., and the big joke about big data, people kept saying, we are drowning in data, but we can't get to it and get anything meaningful out of it, right? So how do we make these data matter in the lives of our citizens? You know, it's really the mission of MOHEC to do whatever we can to enable all of our citizens to have healthy lives, to have the supports they need, and the opportunities they need to have healthy lives. So data helps us know what the problems are, what the issues are. We saw a lot of that this morning. But data can also help us answer the why and the how. And we heard a little bit about that in the qualitative data, some hints about that. And then importantly, data can help us look at the outcomes of our interventions. It's not a popular thing to say, and it's sad, and I hate to say it, but the truth of the matter is a lot of money gets poured down the black holes of really good intentions. So just because something sounds like it really makes sense and it'd be a wonderful thing to do, hard truth is it turns out it may not really work very well. Because a lot of these issues are complex, they take a long time, it's hard work, but it's the only thing that works, is to really have an authentic understanding of these problems, of these issues, and of these communities and populations. I think data can be used to shine a bright light on a lot of issues. You know, it hasn't been that many years ago or that long ago that, and some of you in the audience know this well, that the data Missouri collected was white, black, and other, you know, in a lot of the programs. I kid you not. And now it's, you know, well, it's getting better, but for a long time it's white, black, Hispanic or not Hispanic, and other. You know, we have a complex population. We spoke 85 different languages at the University of Missouri last year, right? So this is a complex issue. And if you don't collect data in a meaningful way, if you have your intake people at your hospitals and health systems guessing in some places, then all kinds of bad things happen. But one of the bad things is that you don't know what's going on in your populations. And so if you don't even know what the issues are, you can't really take steps to work to achieve health equity. Now, we've learned a lot through the years about the Hispanic Latino population, the African American populations in some parts of the state. We've learned more recently about mental health issues and their challenges and their providers. Substance abuse was brought up earlier, and that's a huge challenge that needs a bright light shined on it, in my view. We've learned a lot recently about the LGBT health disparities that exist in the state. And more recently, we're learning about rural women in Missouri who are dying at earlier ages than in past years. So we can use data to shine a bright light on sometimes invisible populations even, and if not invisible populations, invisible problems. You know, I can't help but think of the anecdotes that are, you know, going around in my brain right now. And my sister lives in a rural part of the state, and she had a neighbor who was obese, uninsured, never went to the doctor, and one day they just found her at age 49 dead. You know, there are people in our state who are invisible. Invisible. You know, and I just saw a story this week where the early death rate for women, there was a study that came out that said there are 2 risk factors that look really causative: smoking and lack of employment. What does lack of employment go with? Lack of health insurance, not going to the doctor, not taking care of your health, dying earlier, being a statistic, being invisible. So, and you know, we all have a gazillion stories, right? That patient drove past that hospital because of trust issues and had that heart attack. That good friend's mother who did that because she didn't trust the health system in an urban area, drove past it and died young of a heart attack. You know, these things have got to stop. And you guys are part of the solution. You are the solution. Do you feel it? Do you feel it? Because it really takes everybody. You know, it really takes everybody. Data is best, I think, when it's local, if not regional. We learned early on when we first started this work that a lot of the research out there about the Hispanic Latino population was out of LA County. You know, and what works, you know, in LA may not work in some of our communities, right? So it's hard work, but we really need to test and try and do things with our own communities. And we need to know about our own communities and what their issues are. And that's tricky. Data works the best, in my view, in the hands of the community. Not having outside people say, this is what's going on in your community, but having the community own the data so they understand their own data. And you're going to hear this afternoon some examples of leaders in our state who have used data to understand the issues, have used data to figure out the why and the how, and to measure outcomes. I think you'll be inspired by this afternoon's panel. But we need many, many more such stories. We need lots of stories like that. So I think what I'd like to ask you to do, I know this is hard, this is really hard, but after you get your lunch, if you could change up where you're sitting and not sit with your people and sit with some new people, that would be lovely. How many people here are from, let's say, government? Ooh, all right, government. Okay, you see the government people? Okay, all right. How many here like patient advocates? You know, like really patient advocates? Okay, all right. How many people here in academia? Okay, you see those people? Oh, they like to sit up front. And then payers, funders. I know Missouri Foundation for Health, but other funders in the room. So in the front here and in the back. Okay, you guys see them? Everybody's going to want to sit with you. And then healthcare providers, just healthcare providers. Okay, yeah, okay. Good. We've got a great mix. Did I miss anybody? Nonprofits? Nonprofits. Lots of nonprofits. Look at that. Okay, good. Did I miss anybody else? Health department. Okay, health department. Okay, there's the health department table right here. So, you know, I would invite you to pick up a box lunch and then come back and try to sit with some other people and get a conversation going about what we can do. If you reserved a vegetarian option, you need to talk to the event staff. And I should tell you that we're not the only group talking about this. I spent the morning, there's Summer in the back. I spent the morning with Mo HealthNet leadership talking about how we can use data to really improve the quality of care for our citizens. And so I think a lot of people are looking at this challenge. It's a big challenge of our lifetimes, those of us in healthcare. It's an exciting time to be in healthcare. We have more data than we've ever had, but how do we use that data in a meaningful way, in a local way, and how do we invest communities and empower communities to own their data? Because that's what gets it done. Shannon told you the example of Sedalia. Anybody here from Sedalia today? Okay, well, we're going to brag on them anyway. So they got together and they looked at their issues. They looked at their data. They saw the teen pregnancy. They saw the 7th graders getting pregnant. They looked at their smoking rates. They looked at their obesity rates. They looked at the fact that their young mothers were only breastfeeding for 1 month. And they went to work and got, with no funding, by the way, they're in a foundation desert. So with no funding, just community leaders getting together and saying, what are our problems? These are our problems. Let's fix these problems. So the leadership of the health center, the health system, the leadership of the public health department, the leadership of their federally qualified health center, and the leader who does healthcare in the schools. All these community leaders got together to solve their problems. I find that terribly inspiring. I don't know about you. But that's where it's at. Communities taking charge of their own community because they know what's going on, they know what works. So with that, I hope you're inspired to get a lunch and sit with somebody else and have a conversation about what we need to be doing and then feed that back to MOHEC. Oh, we also, you might notice, we have did you talk about the blogs? Yes, so you're going to?
Go ahead.
Okay, you can talk about it again. Okay. We have blogs that we'd like to get going, and I think lots of you would like, I can see a blog on drug use. I can see, lots of these comments we've had today, I can see some blogs coming out of this group, so be thinking about that. And yes, I'll get my blog to you soon. For sure. And then we do regional meetings, and the MOHEC project is more than just about data. It's about all kinds of other things that we're doing. So in the next year, you'll see some videos. In the next year, you'll see more communication. And we have regional meetings where we report on what we're doing and what we're finding. So I really hope you all will look at the regional meetings and come to those regional meetings where we'll have a broader discussion of the MOHEC program. Okay?